Right now, Vermont state officials are preparing to give their regular Tuesday update on the state's ongoing response to COVID-19. Let's go live to Montpelier now.
I'm Mike Smith, Secretary of Human Services. Governor Scott is currently on another call with fellow governors and White House officials, but he'll be joining us shortly, as always, on Tuesdays. Today, I will review the vaccination timeline we announced on Friday and provide an update on our progress with the vaccination program. I also want to share an important milestone. 1 in 3 Vermonters have received at least one dose of the COVID-19 vaccine, and it's expected shortly, maybe even by the end of the week, that 1 in 5 Vermonters will have received both doses of Pfizer or Moderna or one dose of Johnson & Johnson vaccine. These Vermonters are either fully vaccinated 2 weeks after receiving their final dose or on their way towards full vaccination. We are one step closer to ending this pandemic, and we're encouraged by the high percentage of Vermonters in each eligible age group that have made an appointment to receive a vaccine. So now let's start with a reminder that this accelerated vaccine schedule begins this Thursday, March 25th. For those aged 60 and over, registration will open at 8:15 a.m. You can register online at healthvermont.gov/myvaccine. This is the preferred method. If you don't have online access, you can call 855-722-7878 if you're unable to sign up online. For remaining age groups, registration opens on March 29th for those age 50 and over, April 5th for those age 40 and over, April 12th for those age 30 and over, and April 19th for those age 16 and over. Please remember, it will take approximately 2 months before you have gotten all your doses of your vaccine and are considered fully vaccinated. The date registrations opens for your age group is the date you are eligible to be vaccinated. The goal is to have all Vermonters fully vaccinated by July 1st. We are focusing on administering as much vaccine to Vermonters as quickly as possible. We are administering between 3,700 to 7,900 doses per day. That's per day. Our average, per day average, is 5,500 daily Vermonters vaccinated. And as you know, we have clinics all over the state 7 days a week. As the amount of vaccine we receive from the federal government increases, we will continue to increase capacity to administer it, which includes activating a contingent of the Vermont National Guard on April 15th. Our healthcare partners and the Vermont National Guard are essential partners in this vaccination process. We have activated the Guard throughout the month of March. We will again activate them on a larger contingent on April 5th. So the overall progress to date, in terms of overall progress as of this morning, 179,600 people have been vaccinated against COVID-19. 82,500 have received their first dose of vaccine. 97,100 have received their first and last doses. 86% of those 75 and older have been vaccinated. 86% of those 70 to 74 have been vaccinated, and 66% of those aged 65 to 69 have been vaccinated. Turning to our educator clinics, a total of 23,000 educators and eligible child care providers have received a first dose or have made appointments. Upcoming educator clinics still have available appointments, including March 25th in St. Albans, which has 103 openings. Other clinics with available appointments include Berlin, Grand Isle, and Plainfield on March 26th, Wells River on March 27th, and Rutland and Hartford on March 29th. We want to make it easy as possible for you to make an appointment to get a vaccine. I want to remind everyone that you can make an appointment at one of our health partner clinics through the state website, which includes Costco and Walmart. So if you want to make an appointment to one of our vaccination sites, please use the state website, which includes Costco and Walmart. If you can also make an appointment directly with with Kenny Drugs, CVS Pharmacy, or Walgreens. All these options are available at healthvermont.gov/myvaccine. Please remember to cancel your appointment in the state system if you get a vaccine at one of the participating pharmacies. That will allow us to reallocate that appointment to someone else. Again, I encourage everyone to go ahead and create an account online at healthvermont.gov/myvaccine so you can simply log in and make an appointment when it's your turn. Thank you, and I'll now turn it over to Commissioner Pieciak for our weekly modeling update.
Thank you very much, Secretary Smith, and good morning, everyone. I again want to start today with the data that holds the most promise and is having one of the biggest impacts in Vermont, which is the number of Vermonters who are stepping up to get vaccinated. As Secretary Smith mentioned, the uptake among our oldest residents, who are also our most vulnerable residents, representing 90% of Vermont's COVID-19 deaths, continues to be strong, with more than 85% of residents 70 and older now having started or completed vaccination, and those 65 to 69 saw a 28% increase this week, moving up from in the low 50s to the mid 60s, and many more ready to get vaccinated in the days and weeks ahead. And when we look across the country, we see that Vermont now stands as the second highest vaccine uptake among our most vulnerable population to date. Again, many more are scheduled to be vaccinated over the days and weeks ahead, but as a group, we stand at over 80% for those that are 65 and older who have started or completed their vaccination. This early uptake bodes well for both protecting our vulnerable Vermonters now and also the expected vaccine uptake we plan to see across all age groups into the future. Again, the key to ending the pandemic, protecting our communities, and returning to normal is for all of us to get vaccinated. This small step will turn the tide against the virus and help save lives. This week we reported 850 new COVID-19 cases, an increase of 61 cases over the last week's total. But again, as you can see, looking a little bit further back at the last 5 weeks on a 14-day average, our cases have remained relatively stable here in Vermont, averaging somewhere between 100 and 120 cases on average a day. But again, even though our cases have remained relatively high recently, the cases among our most vaccinated, who are also our most vulnerable, continues to remain low and continues their downward trend. While cases are only down 25% since the overall peak in January among those that are 70 and younger, those that are 70 and older have seen a 75% decrease, a considerably more decrease, and the trend continues to go down even as cases remain stagnant among the younger age groups. We continue to see the impact of the vaccine's protection in long-term care facilities as well. While cases again have remained relatively high across the state, they continue to be very low among our long-term care facility residents, having reported just 6 cases in the past 3 weeks. You'll see that there are currently 4 long-term care outbreaks that are active, but again, these outbreaks remain considerably smaller than the outbreaks we saw in December and January before our vaccination program had made as much progress as it has today. We continue to see the favorable impact of vaccination with our median age of COVID-19 infected Vermonters falling to 29 years old. This is the first time the median age has been below 30 since September. September was a month when we did not have a single COVID-19 death, nor did we have a single COVID-19 ICU admission. So again, this should give us some hope as we look into the future. The Vermont case forecast continues to remain stable without much change this week, with the short-term projections again anticipating cases to remain relatively high, and then cases expected to decrease as we get further in our vaccination program, and nicer weather means that we can spend more time outdoors where it is safer. Turning to hospitalizations, we are also seeing the favorable impact of vaccinations on this metric as well. The total current hospitalizations are down 62% since the peak in early February, and down 16% over the past 7 days. But again, we are seeing that there are many fewer Vermonters who are age 70 and older going to the hospital when they contract COVID, and this is one of the reasons for the decrease overall. Individuals 70 and over requiring hospitalization have dropped significantly between January and February and are on pace for a lower month in March as well. And with more individuals 70 and older who are started or completed vaccination, which is leading to fewer cases and fewer hospitalizations among that age group, we are also thankfully seeing that impact on our fatality rates as well, with the weekly COVID-19 deaths continuing to decrease over time. Measuring from the start of the year, Vermont has had the second lowest per capita fatality rate in the country, and the two states closest to Vermont, Alaska and Hawaii, certainly have a very different and geographic advantage in terms of their isolation to mainland United States. So Vermont is doing exceptionally well when it comes to fatalities overall since the vaccination program has started in earnest. Across the country, you can see that the impact vaccines are having is making an impact there as well, with the 7-day daily death rate falling 24% over the past 10 days. And while deaths continue to fall across the country, cases have stalled or even increased in recent days. And when you look at the case growth regionally, you can see some differences in the trend, with the Northeast and the Midwest seeing their cases clearly stall or increasing, while the South and the West have actually continued on a downward trajectory recently. Looking at it from a state-by-state perspective, you can see this trend as well. And it's worth pointing out Michigan in particular, who has seen a very large increase in their cases over the past 2 weeks and has actually seen an increase in their hospitalizations as well. This is at the same time they're seeing variants reported in high numbers, and while their vaccination program is lagging as well. So this is again a reminder for Vermonters about how important it is for us to win the race here in Vermont against the variants by stepping up and getting vaccinated when it's your turn. Taking a look around the region, we see that cases in the Northeast are ticking up a bit, with 8,000 more cases this week compared to last. And again, we can see that each jurisdiction in our region, with the exception of Quebec, saw their cases go up this week compared to last. Finally, looking at the heat map today compared to 2 weeks ago, you can see that there's been relatively little change in the region over the last few weeks. Like we said, here in Vermont and across the region, hospitalizations and fatality rates do continue to decrease. So even though cases have remained stable, even increased across the region, hospitalizations and deaths are continuing to fall as well. And with that, I would like to turn it over to Dr. Levine.
Thank you. As you've seen, the Northeast has had an increase in cases. Our cases in Vermont, while averaging in the 120 range, are ranging from 50s to the 150s. Hospitalizations in the last day have ticked up a slight amount to 27. Stable ICU, 5. Positivity rate, 1.6%. Deaths have only increased by 1 and are now at 220. This again, though, as you saw in the data, is testimony to our vaccination strategy. I think we're all feeling the same sense of relief right now that winter's coming to an end. The first real warm weather and sunshine is always more than welcome after a long Vermont winter, but this feels especially energizing and hopeful after long months of, for some, isolation. But you probably aren't looking to me for a weather report. When paired with all the good news about our progress in vaccination, it's easy to feel like the end of the pandemic is near. So here's the forecast I do want to give you. Things are indeed moving forward, but I have to caution that though we know changes are coming to life as we've known it in the past year, they're not here quite yet. If you've been listening to any of the public health experts on national media, I hope the message you're getting is that we are all aligned in our assessment of where things stand. You've just seen the data. The favorable steady declines in cases seems to have reversed somewhat, nationally, especially regionally, and even locally. Not a gloom and doom message by any means, but neither should anyone yet declare victory. We know the finish line is near, we can almost see it, but it's also the point in the race where stumbles can be most risky. I want you to get outside, get some exercise, plant those gardens, and enjoy these moments together, but please do so safely. We're still in a very delicate time where the virus and its variants can and will take advantage of us if we let our guard down. It has the potential to set us back in our efforts, hampering us in the race. Only by continuing to wear our masks, keep our distance, and avoid crowds can we continue to keep the virus at bay while we vaccinate as many Vermonters as we can as quickly as we can. Keep the gatherings small, try to avoid travel that's not essential, and get tested. The news of the vaccines we have continues to be good, and others in the pipeline pending FDA approval. The prospect of an additional vaccine may not have an impact on our current vaccination plans, but I welcome the continued research and review. It's important to have vaccines we can rely on here and on a global level. This is, recall, a pandemic, and with the return to global travel again on the horizon, we want to be sure that variant strains of concern do not develop here or anywhere. Now, the vaccines are not all the same, but I want to emphasize that they are all proven to be safe and effective. They use technologies that have been many years in the making. This amazing science has produced, in just over a year, which is unprecedented in medical terms, not 1, not 2, but 3 vaccines that can help prevent sickness and death from COVID in the United States right now. Think about where we are now and where we would be without them. And when it comes to the type of vaccine you may get, I do want you all to know the best one you can get is the one you can get right now. It's okay to ask questions, to learn more about the vaccines that are available, but while this pandemic is still raging, there just isn't time to wait. Get your shot, whichever one it is, when it becomes available to you. Before closing, I want to make one more request. Up until now, a huge part of the emphasis has been on older and more vulnerable Vermonters, watching out for themselves and doing everything they could do to avoid getting COVID. And for the rest of us, to try to protect them as much as we could by abiding by the safety guidance and not potentially transmitting or exposing them to COVID. Well, now, as you've seen, older people are far more protected by vaccine, or soon will be. So the next request I am making to Vermonters, especially those in the teenage years to age 40, is that you protect yourself. You've seen the data. The highest case counts are now among people in these age groups. Why worry about protecting yourself? Because of a topic I haven't touched upon recently, but which has made a comeback again in the news cycle, long-haul COVID, or PACS, post-acute COVID syndrome. I've talked about this a number of times previously. It's true we have so much more to learn about this and to understand how many people are at risk. But whether the number is 10% or 30%, all I know is that this pandemic has been called the largest mass disabling event in some time. And it does not spare a person because they are young, and we don't know enough about it yet to accurately predict who might be at risk. Chronic symptoms that continue to surface 3 or 4 months after initial illness, even when the initial illness is mild, and those symptoms don't seem to go away, with many possible manifestations, from chronic fatigue to shortness of breath, to exercise intolerance, to brain fog or memory loss. I don't want anyone to risk developing this, to have your lives hindered by what is starting to become an avoidable virus. To avoid it, it really isn't that tough. Simple prevention advice. 1, don't let your guard down now in this home stretch. Keep up with masking, keeping a safe distance from others, and avoiding crowds. 2, get tested if you find you've been in a risky situation or think you might even have minor symptoms. And 3, get vaccinated. After enduring what you have for the past year, you owe it to yourself. The governor will make his comments when he returns from his White House phone call, so we'll open things up now.
All right, just a heads up for folks, there are 24 reporters in the queue, which is about 3 more than usual, and we have been going well after 1 o'clock. So just request to the reporters to please keep it to, 2 to 3 questions or fewer. We'll start in the room with Calvin.
Thanks, Rebecca, and thanks, Dr. Levine. So this is probably a question for maybe you and Commissioner Piszczek as well. Your forecast still says we're going to have, high cases, and then we're still dipping off in late April. I guess given the spread of the variant and those new strains, how confident are you in your projection?
I'll just comment on the variants as he comes up to the podium. So the B117, which is the UK variant, is 50% more transmissible than what we've been accustomed to. So if we're accustomed to one person being able to infect one other person, this would mean 1.5 other people. The B1429 variant, which is the most recently one we've discovered here from California, is 20% more transmissible, so doesn't make as huge a big difference in how it's transmitted.
Thanks for the question, Calvin. All along we've said that it's really personal choices, personal behavior that's really going to dictate the future in Vermont, and all the more true here. But what's unique now is that personal decision, that personal behavior is about stepping up and getting the vaccine when it's your turn. If we get the type of vaccine uptake among the younger groups that we're seeing among the older groups, I think there's a great deal of confidence in this forecast, and the forecast is accounting for an increase in vaccination. Of course, the weather improving and people being able to spend time outdoors more safely, there's certainly gives us some hope and some confidence there as well. But then just look what we talked about in Michigan. When they have a lagging vaccination program, they have a lot of variants already in their state, they're seeing their cases rise. There is still that real concern that can happen anywhere. But what Vermonters can do is, keep themselves safe and get vaccinated in the meantime.
And then maybe this is a question for the governor, but you look at the messaging and how you reach some of these populations of younger people. I guess what does that look like, right? 18-year-olds, 19-year-olds might not be reading the news every day, and I'm just thinking of the spread of the variant that we're seeing in EM. So how do we reach that level of communication update?
I'll let Dr. Levine talk about a little bit about the strategy around getting to those Vermonters that are a little bit maybe harder to get to.
So as we get closer to where those age groups fall, you're going to see a variety of, you may not see them, but hopefully those age groups will see a variety of messaging campaigns, much on social media, but not exclusively, some on very traditional media. And really what it tries to get at is where their hesitancy is and try to work with them as opposed to just dictate to them, get a vaccine, because that doesn't work for anyone. And really understand their characteristics better and what makes them feel that getting a vaccine may not be in their best interest. I was very specific in my comments today to address this post-acute syndrome because it is a rising concern. The medical community as a whole knows very little about it when you think about it. The fact that we've had a year now, but we're seeing more and more, and we're hearing more and more about this. And I don't wish that on anybody. And we're hearing that even in a younger population who had a milder illness, these can creep up on them over months and be very debilitating. And then finally, there's also going to be, I think, a little bit of emphasis on access, because sometimes it's not a very profound reason why someone's not getting vaccinated. It may be as simple as, it doesn't fit in my schedule, I don't have time, I have to go out of my way, I have to go set up an appointment here or there. So as we start thinking about our high school students, our college students, there's certainly opportunities to perhaps at that stage of the campaign bring vaccine to them, because the reality is we will have gone through so much vaccine already, and so many people who are eligible will already have had their chance that we may be in a excess of supply and be able to have the luxury of doing that. And I know there's also things like drive-throughs where you essentially don't even get out of your car, which could certainly be attractive at those times as well. And of course, it'll be warm weather. It'll be perfect for that.
I might just have one last follow-up to the governor, but thank you.
Steve?
All set, thank you.
Stuart, NBC5?
Good morning. Will the no travel rule for the not yet vaccinated remain in place even as cases and certainly deaths decline? I mean, in other words, is the rule going to remain in place until we are all fully vaccinated?
You're using the word rule. I don't want that to be misleading, because that's not a rule in Vermont. I do know that in CDC circles, they're still counseling against travel, or they're calling it unnecessary travel, what have you. So I think at this time of uncertainty where variants and increases in counts and things are happening and vaccination hasn't fully set in, they're not counseling for travel. But I think you can expect to see things change in that over the ensuing months.
So if you're
Sorry,
not yet vaccinated, you're still awaiting your turn, you would be permitted to leave Vermont to go to New Hampshire or Maine or something?
Stuart, it's Rebecca. If I could just, since the governor's not here yet, first would just note that there is not a no travel rule. There's just a quarantine requirement if you do travel. So I just want to clarify that folks are able to travel, but they must quarantine, though it's discouraged to do non-essential travel.
Right.
And then I would just point you to what the governor has said about rolling out a longer-term plan in the coming weeks. So I think you can expect more information on this.
Okay, thanks.
All set, Stuart?
Yes.
Okay, we will go to Lisa at the AP.
Thanks. With Dr. Levine sending this message out to younger people to protect themselves, and we've seen an uptick in cases recently and in Vermont recently, as well as one other thing I want to ask. Can someone there describe, I know the governor's not in the room yet, but could someone talk about the decision to allow bars to open?
About what about bars?
Allowing bars to open, maybe Secretary Curley?
Yeah, I'm happy to help with that. Bars will be permitted to open on Wednesday, but they're required to follow the restaurant guidance. And what that means is that their patrons need to be seated, and they need to be seated if they're at tables that are no larger than 6. And if they're seated at a bar, there has to be a plexiglass barrier between somebody that's preparing drinks, for example, and their patrons that are sitting at the bar. It also means the last call is at 10 o'clock. It also means that they have to keep logs of their customers for 30 days. So the idea of a bar being open is not, as you imagine, people standing shoulder to shoulder having their cocktail socializing. They can come in and they can be seated, but bars are able to do this without serving food as well. They can serve just beverages if they want to the people that are there seated. Is that helpful?
Yes, I was hoping you could talk about the decision, what went into the decision to allow them to open. I'm sure that, they've been closed for a long time and are hurting economically.
Sorry, I was on mute. Our team talked a lot about, the bars and the social clubs were arguably fully closed, and we've been wanting, to try to find a way for them to safely be reopened. And again, with more of our at-risk population being vaccinated, we agreed that, we were not seeing transmission in the restaurant from the guests that were seated, as I just described. And so this was a path forward. It's a really small turn, but it's a path forward for them to start to reopen. And hopefully in the coming weeks, again, as we have more of our population vaccinated, we can continue to open them up more broadly. But the discussion really, we talk about all the sectors. We have a variety of other sectors that are still in a posture of being, restricted to 25% or 50% occupancy. And we know that is something that makes it difficult for them to deliver their service or make their product. And we continue to try to find safe ways to get them open. And as you heard Rebecca say earlier, we'll have a plan rolling out in the next couple of weeks, that will hopefully show people how we plan to safely get, more broadly open and let people move around a little bit more.
And just again,
thanks, Secretary Curley.
Lisa, this is Rebecca. Just again, sorry to keep stepping in, but with the governor not here, I just wanted to share some additional context. Additional factors under consideration, and Dr. Levine might be able to speak to this as well, would be the level of vaccination among the vulnerable populations, as well as recognizing that this is not even a return to the level that these establishments were open in October. It's actually even more strict than what they were open in October. So that's important context as well. But I don't know if Dr. Levine could speak to the vaccination levels.
Yeah, and certainly for the social clubs aspect, with an older population attending many of the functions there, and the way over 80% uptake of vaccine in those populations, it only makes sense to allow them to be able to enjoy some of the privileges that were just outlined by Secretary Curley in terms of attending those again.
Okay, thank you.
Ann Wallace-Allen, 7 days.
Hi, thanks for taking my question. So I couldn't hear Calvin's question, and maybe he asked this, but do you guys know any more about why the Northeast is rising slightly? I mean, I keep hearing theories that maybe Vermonters don't have some sort of immunity that other states might have acquired because so many people here haven't been catching it. What do you know about what's going on in the Northeast at large?
Yeah, thanks for that question. This is Dr. Levine. That certainly, out of every Northeast state, Vermont is the one that would stand out with the least natural immunity to COVID. You know, we're talking like 5%, whereas there are other states in the country where you're talking over 25% of the population might have natural immunity. I don't want to say that that's the reason that the entire Northeast is having an increase, though. I see some of this as, I hate to use the word cyclic, but somewhat cyclic in the way this virus has behaved, where it sort of came into the Northeast in a big way, left the Northeast, and then all of a sudden we saw over the summer the South and the West, and then as the summer progressed into the fall, it was the Midwest. It seems to sort of surge in places and then diminish, and then if you give it enough time without a vaccine yet in a population that's not immune, it repeats the cycle. Commissioner Pichek, do you have anything to add to that?
So, and the only thing I'd add is, you know, when you look at the regional data, the Midwest and the Northeast are the regions that are increasing. The West and the South are the regions that are seeing their cases continue to decrease. So if you think about the weather in those locations, certainly the weather has been, you know, sort of much more seasonal out west, down south, easier to get outside, easier to be safe. The Northeast has been a little colder until recently. Some states have suggested that as more and more of the vaccine is being delivered and people are taking it, that, you know, folks are starting to put the pandemic behind them, younger folks, even though the threat is still real of contracting COVID for yourself. So maybe a little bit of, you know, of an attitude of the, you know, thinking that you don't need to be on guard as much as causing cases to increase in parts of the region. So, you know, I don't think there's any one theory that explains it, but when you think about what I said and what Dr. Levine said, I think it helps account for it a bit.
All right. Thanks. I have another question, too. I'm wondering what's happening in the Northeast Kingdom in terms of people deciding to get the vaccination. It sounds like Derby Elementary and Derby Junior High are closed because of a COVID outbreak this week. So it sounds like, you know, cases are still a problem in the Northeast Kingdom. I'm just wondering, how have you guys added some clinics to get people to get their shots? Are people doing that?
Secretary Smith will answer that, Ann.
We've been concentrating, Ann, on Essex County. There have been some cases going up there. Just as a reminder, a few cases can show a fairly significant spike because of the small population up there. But we did a week ago, Thursday I think it was, that we met with local and state officials in the Orleans and, the Essex area to see what we could do to sort of help bring up the vaccination levels in those in that county. And what we started is putting up road signs to advertise some of the clinics that are going to be up there. We're looking at maybe adding clinics as well as looking at the New Hampshire side, especially in Colebrook, and see if we can partner with information sharing in terms of their ability, because a lot of people go over to Colebrook from Canaan for primary care, and maybe working with their primary care and their clinics over there in order to provide information for clinics in Vermont. So we're looking at a wide range of options up there to try to bring up the vaccination level. We're just going to have to see in the next few weeks whether those strategies work.
All right. Thanks. I just have one more question, and this one is about young people. I know that nobody has had the experience yet with young people in this particular vaccination to know exactly how they feel about it. But that said, in general, what have you heard about for other states that didn't have the same age banding that Vermont has? Like, what works in getting younger people who have heard that it's just not as dangerous for them to have COVID? What works in getting them to get the vaccine? What kind of strategies, other than advertising on social media, are you guys going to employ?
Yeah, we have a communications strategy, and we'll take our cues from what people are telling us. We're putting that together right now, actually, in terms of those that are 16 to 29, and making sure that they understand, you know, what sort of drivers will incent them to go and have a vaccine. I think you'll start seeing that. Obviously, we're going to concentrate heavily on social media because that age group is social media savvy. So we're going to be concentrating on social media. But what are their, you know, using their friends to help them understand why it's important to get vaccinated. Us telling them what to do is not going to work. We have to have their friends telling them why it's important. And I think you'll see a strategy that relies on peers talking to peers about getting vaccinated.
Interesting. Thank you.
All right, the governor is here now, so he will give his remarks.
Well, good morning, everyone. I just got off the phone with fellow governors in the White House for our weekly call, and here's some of what we heard. First, we had an update from Dr. Fauci on a few items. He discussed that they're watching Europe closely as they're seeing a rise in cases. But he also said it's important to note how much better we're doing here in the U.S. on vaccinations than they are. He also discussed the AstraZeneca vaccine, which has made some news over the last few weeks. And last night they indicated they were going to apply for emergency use authorization from the FDA. Dr. Fauci believes that they will eventually be granted authorization. And he also stated that he feels himself, and it will go through a rigorous process with the FDA, but he thought it was a safe and effective vaccine. And he talked specifically about some of the clotting issues and so forth. So, but he was convinced that that it was safe from his perspective. He also talked about where things are for vaccination of children, looking ahead. He thought we should expect all high school students will be eligible this fall, and young children by the first part of next year. So they're doing trials at this point in time, and said that's going well, and he fully expects that high school students, by the time they go back to school in the fall, will be able to be vaccinated. Next, we received an update on supply. For Pfizer, we heard there will be a one-time dose increase. They first told us that there was going to be flat for this week, as they had prepared us for last week. But then they said that they had found some extra doses, and they would increase by 1 million doses for this next week. That was for Pfizer. And that will mean 1,000 doses for Vermont. And then on Johnson & Johnson, this week, they're distributing an additional 1.6 million doses. So that means 1,600 for Vermont. And then they talked about the federal pharmacy program, and they will also see a one-time increase of about 1 million doses of the Pfizer Moderna, which would mean about 1,000 doses for Vermont, but also a 1.5 million increase of doses for Johnson & Johnson. So all told, that would be 2,500 for the pharmacies, 2,500 doses for Vermont. So when you add that all up, again, with one time and the increase in supply, especially with Johnson & Johnson, which we haven't seen since the beginning, that's about 5,000 more doses this week than last week. So that's great news for us. When you add it all up, I believe, if I have my math right, and maybe someone can correct me if I'm wrong, but I think that means we'll be at like 23,000 doses this week, but I'll let one of you figure that out and correct me. So again, this is on top of what we heard last week, which gave us the confidence we needed to roll out our vaccine timeline. As a reminder, and as Secretary Smith said again, Every Vermonter over the age of 16 will be eligible to sign up by April 19th, with the next age band, 60 plus, opening this Thursday. And I myself am looking forward to signing up because I believe every Vermonter should sign up when they're eligible. So I'll be doing so myself when able to do so on Thursday. As I said last week, in the next couple of weeks, as vaccinations ramp up, I'll be able to outline our plan with timelines and details that will allow us to work towards normalcy. But it's important to remember, even with the vaccines, the number of vaccines we're able to put in the arms of Vermonters, this virus isn't going away and will likely be with us for a while. So we should be prepared for that. At the same time, we're already seeing the positive impact of the vaccines with deaths and hospitalizations falling. Again, our top priority since the beginning has been to maintain the capacity of our hospitals and limiting deaths. And because of your hard work, we have the fewest number of deaths in the entire country. So over the next several weeks, as we get shots in arms and there's more mobility, please remember it's still really, really important to remain vigilant and follow the health guidance. Because if we do, we're going to be in a far more better position to have a normal summer. So that's something to look forward to, but we all have to do our part. With that, we'll get back to questions.